Namaskar, good evening. I am Dr. Bharat Patodiya. Today we are taking this opportunity to explain regarding this particular machine which is known as electrical muscle stimulator. This machine is actually famous for among physiotherapists and sports rehabilitation for muscle stimulation by electrical stimulus. But in my experience, I have used this machine in oncological cases also. So cancer patients who are weak because of poor physical conditioning and because of chemotherapy, they are further mentally and physically conditioned not to work out at all. I find this machine particularly very useful for people who are not very motivated to do physical exercise, or they are too debilitated because of chemo or side effects or surgery or nutrition loss. They don't work out, so muscle loss is quite evident in those patients. I find it pretty useful. So I am going to demonstrate my own machine. This is a 20 channel machine. There are a lot of other models like 16 channel, 12 channel, 8 channel, 4 channel, 2 channels also. Please watch my other videos regarding the reviews of those machines. I am going to have an explanatory review on other channel machines also. But this machine I use for myself. I particularly like this machine because it has 20 channels. 20 channels means 40 pads. So what is a channel is, if you see here, there are knobs. Each knob, so each knob gives one wire which have two ends, and it can help us to stimulate one muscles. So a 20 channel machine can help me stimulate 20 muscles at a time. That is 10 muscles of this side, 10 muscles of this side. The benefit of higher channels is it takes less time to stimulate maximum muscles. I find a lot of my patients, for reasons unknown to me, buy a smaller machine, maybe 2 channels, 4 channels. What I observed is they lose the motivation because by just 4 channels they can stimulate only 4 muscles. It takes long time to cover the full body. So a caregiver burnout happens. Patient get bored, caregiver get bored, it takes too much of time. Everything. So I suggest you buy a larger number of channels. Yes, the portability, so the bulk of the machine increases with the number of channels. So 4 channel is definitely more portable. I will be having another review on a portable electronic muscle stimulator. So today I will be covering proper utilization of this machine, proper pad placement on the body, because I see a lot of machine giving wrong information about pad placement. Many patients don't understand how pad placements to be done. And another most important thing which people miss out by purchasing a smaller machine is what happens in a smaller machine, 4 channels. To attach these pads, these are non-self-adhesive pads, it doesn't attach by themselves. You have to apply something, some pressure over it. So either you can hold it, which is not practical, or you have to wrap around an elastic band. So these smaller machines which have just 4 channels or 2 channels or 6 channels don't give adequate number of these elastic pads. These elastic pads are very, very critical for right placement and correct stimulation of the muscle. So if elastic pad is not tight, you cannot generate enough pressure on the pad, and you should have adequate number of electrical EMS elastic pads also, because with higher number of pads, lot of placements are there. So you will need the electric pads to have a crisscross for chest and the back, on the belly, thighs and the calves. So what I use is, along with this model as well as 16 channel, 12 channel, company gives this machine is of the Med Gears. There are a couple of more companies like PhysioWell on Amazon. Flipkart also. So this particular company is giving around 10 elastic bands, two of larger length for fat people who are having a lot of tummy, two of the medium and four of the small size. You can join these pads if you need a particular length which is not suiting you. Another thing which I found it useful is this elastic corsets. These are elastic corsets. So basically these is used for women for body shaping under their dress, but I find it very useful because once I wrap it around me, almost whole of my core can be covered with these pads with just one elastic. So I don't need to use too many elastic bands for a proper placement. I will be covering regarding the correct placement in my later part of the videos also, but this is a vital part for correct placement. So please don't stop yourself from buying these elastic corsets. So starting with the explanation of the machine per se, as I said, this particular machine is 12 channels. So 4 and 12 channels. I'm going to start it. Okay, now with this close-up we are going to explain the functioning of this particular machine, which is 20 channels. You can see here there are 20 channels, 4 and 12. Don't get intimidated by number of wires and knobs and everything. I'm going to explain you how to get organized with this particular machine because I'm using it quite often on myself. So I'll start the machine. So there is a start button here once you connect it to the main switch. So pretty simple, there are just 4 buttons. First is frequency, program, timer and start and stop. Okay, I am going to cover more in another video regarding more on frequencies and what frequency to use the max, but in general when you are using for electrical muscle stimulation, you should work on lower frequency, somewhere 20 or 50, not more than 80 or 100, because then it is nerves which start getting stimulated. So coming back to this machine, these knobs determine the intensity, how much current is flowing inside in this channel and how strongly your muscles get contracted. What does frequency determine is how many electric currents are per second is gone into these channels and ultimately into your muscles. So lower frequency work on muscles more, higher frequency works on nerve more. Then there are around 10 pre-programmed modules in this particular machine. Each machine is different. So in this machine, I'm going to share a PDF in my link. What are the different modes? So this mode determine what is the ramp up time of the frequencies and what is the ramp down time, how long the contraction is there, and then how long is the relaxation. Then you have to set the timer. The default timer is 15 minutes and start and stop button. So coming to the organization of this machine, first I used this machine as on table, but then I found that I felt that there was a lot of the complication. The wires were getting all mixed up, jumbled up, and I was not able to get to a solution how to know which knob is determine which pad. So this is my own solution. I labeled one channel. So you can see these 2 pads, this wire, single wire, this is number 10, and I labeled the knob to 10. So I know which knob represent which 2 pads. So if you see any of my pads, these are pad pairs, all are numbered from 1 to 20 and respective knob is also numbered. So this is the home solution. You can do it by yourself by permanent marker. So now with this, since you understand the basics of machine, I will go to the pad placement on my own body. I will be taking help of my subordinate. So welcome back. I am wearing a bright colored dress, and for contrast, because it will tell you the exact placement of the pads. Ideally you should place the pads directly onto your skin, because that way there is a better conduction of current to the muscles. Anything, however thin it is, creates a resistance, reduces the amount going to the muscles. But for demonstration purpose or for practical purpose, if patient cannot put the pads themselves and cannot strip completely in front of the caregiver for any reasons, then you can use a thin clothing. Ideally, thinnest is better. So today here I am showing you on this clothing. Second thing you should understand is conduction. The pads directly by themselves do not conduct too much of current. There are another category of pads which are self-adhesive. So if you touch them, you can see there is a sticky coating on this. Those type of pads do not need the water as a conduction medium or ECG gel. Many of my patients have committed this mistake. They think that ultrasound gel, which comes in blue color, is equivalent with ECG gel, which is transparent. If you are using ECG gel, please make sure it is transparent. For cost effective purpose, I myself use water and I found it to be equally effective. And especially if you are wearing some clothing for any reason, then you will need the water to be better, because the gel will spoil the clothing. So second thing, as I already covered, you will need adequate amount of elastic bands. So from here, few basics of pad placement. The most common mistake which my patient do is placing the pads too close or too far. So somebody will place one pad here and one pad here, or one pad here and another pad here. That doesn't work. There should be appropriate gap between the two pads. If you put a huge gap between the pad, the current dies off reaching the other pad. Second common mistake is one pair of pad should stimulate one group of muscles. So what is a group of muscles? For simple terms, from one joint to other joint, one muscle group covers. So from here till knee, it is one group of muscles. Third principle is you should place the pad along the axis of the muscles. What is the axis? I'll explain it how people put it wrong way. So I see many patients, relatives placing the pad this way. Now understand this, the muscle run along this way. So you should stimulate one muscle group in their natural axis of contraction. So the correct way of placement is this way, not this way. If I place this way, my muscles of this part are contracted in a discoordinated way. So that is not the correct way. You will cause muscle imbalance actually by placing that way. So I will be sharing a JPG picture which you can freely download in my comments, in my details. You can also download this picture from Google or from my own website. So I hope this is clear. So this is one muscle group, this is the axis. Just to explain you further, now the contraction of abdominal muscles happen in this direction, right? Your body contracts this way. So axis is this way. The biceps contract this way. So the axis of the muscles is this. So I guess you can also comment what will the correct placement. Correct placement will be like this, along the axis, not like this. So one pad here and one pad here, no. along the axis. So few machine also have mono and bi mode. This machine don't have that, so I'm not covering that part. Another example, chest muscle. How those muscles are acting. See, chest muscles are not contracting this way, it is contracting this way. This is the function of the chest muscles. So guess it right. The correct placement will be like this, not like this. This is the wrong placement, which I see many people doing it. Okay, so this way. I will be sharing a link in my description regarding a PDF file explaining the muscle fibers, their axis. Feel free to download it and use it. Now I'm starting proper placement of these pads. I'll be taking help of my beautiful wife here. So here comes Dr. Shalini. So starting with this elastic bands, so I have ample of them from 3 different machines I have along with the elastic corset. So first I'll start from upper body. There is no particular way or particular sequence of muscle stimulation. You can start from any way, but try to cover one muscle group at least for 10 to 15 minutes. And another important thing is rest. So once you stimulate, today you stimulated chest, give it 1 day rest. Don't stimulate it tomorrow. At least 1 day rest, and day after tomorrow you can stimulate again. I find if you are using it with very high intensity like I am using, even 2 days rest is good. So starting with the placement of chest pads, first is elastic bands. A good pressure is very important. If your elastic pads are loose for any reason, get them altered with the help of a tailor or buy them new. You can contact Physio Well or Med Gears to deliver only elastic band, not the full machine if you already own a machine. So you can see that this one pad, this elastic band will help me place a pad here as well as here. And so this crisscross placement of the pad helped me to place the pad here. This is my trapezius muscle. Okay, so one pad here and one pad lower. We will show you in detail. When you are using these elastic bands, make sure that the hook side, the hook of the elastic velcro, don't spoil your clothes. Otherwise, you will be spoiling each dress every time. So yeah, so there are 2 ways. You can spray the water first and then place it, or which I find it more comfortable is I can place the pad. So you can see that I place the pad for my chest. Once the placement is done, then your caregiver can just come, lift the pad a little bit and put the pressure, lift the pad a little bit and can put water under it.
T-shirt should also be wet completely.
Yeah, so if you are placing the pad above a clothing, you should make the clothes drenched wet. Otherwise the current will not flow properly. So completely drenching wet t-shirt. Okay, so this is, you can see the contraction is this way. So here I am stimulating lower muscles. Another way of placement is you can place it above here using another elastic band. both ways are okay. For now I am placing it here. So this is the correct way of this. Whenever you stimulate one side of muscles, you should place almost symmetrical placement of pads on this side. So I'm not going to start the machine, it's just for the demonstration. Either wet it or after placement. So this is almost symmetrical, same placement. Another mistake which I see, or I should say I will put it positively, correct way of principles of correct placement is with one channel don't cross the midline. Actually I have covered this point because one muscle group is this. There is hardly any muscle which crosses midline. You know, the muscles of left side remains left side, right side remains right side. No muscles cross the midline. So one pair of muscles, a pad supplied by one wire, should remain on the one side of the body symmetrically. So you should not place a pad like this. So if you want to place a pad like this will be a absolutely wrong way, or I will say most common wrong way. I have even seen a couple of machine literature or guidelines actually printing it that way, which is the wrong way. It is one side of the midline. So this is the midline. So this is for the chest. Now we will demonstrate on the back. So you can see that one pad is placed on the trapezius, another pad is placed in the lower part of the similar muscle group. So symmetrically on the other side. And then before using, you have to wet the clothing as well as the pad. If you are using directly on the skin, the amount of spray required will be less. What happens if you don't use the water? Your machine is not going to get spoiled, but your contraction will be poor. So it will be a futile effort to do. Okay? So
back here we can lower back, mid and lower back we can place here.
Okay. So when I use on myself, for this core muscles, I use corset. But since I am demonstrating you for yourself, using a black corset may actually hide the pads. So I will be just showing you with the elastic bands. Now this pad, which I utilized for my back, in the front I will be using it for my abdominals also. Okay. So this is my abdominal muscles. This is upper abdominal, lower abdominals. Meanwhile, I'll use this one. So probably this pad will be too much for me, and I can probably use it. Yeah, this I can use. So you can see one pad already up for a different muscle group. The same pad I can utilize for abs also, and the lower pad is in the lower muscles, lower abdominal muscles. So now you understand what is the benefit of larger number of channels. In the same elastic band placement, I can apply more and more number of pads. So that saves my time. Actually, strictly speaking, more time is consumed in placing the pads rather than actually you doing the workout. So is it clear? Same line, I am not crossing the midline. The pads are not too far, nearby, around 5 inches or so is the best distance. So similar, one channel, one wire, two pads. This side of the right side of the abs and upper abs. So symmetrical, not too far. Then you have to wet it nicely. See, now I have already used 1, 2, 3, 4, 5 and 6. So somebody have 6 channel, machine is exhausted, but I can place more. So I can one place on my side abdominals, so my side abs. So this area symmetrically opposite this area, which is known as side abdominal. Again, wet it nicely. And even my latissimus dorsi, my wife can place more pads there. So this is my core muscles. So same pads can be, same elastic bands can be used to place multiple pads. So this is the benefit of multiple channels. When you are placing all these pads, it is a good idea to keep the machine off. This is the correct way of pad placement for the upper body. So this is known as upper body muscle group correct placement. Since I have more pads left, more channels left and more elastic band also left, I will demonstrate the correct placement of the pads in my lower body part. So coming to the lower body, few basic principles. This is the front of the your thighs, and the fibers range from here till the knee. So I'm going to show you the correct way of placement. Okay, so now you can appreciate the number of pads and number of channels. Higher the better. Okay, this cloth is pretty thick, so I'm not gonna stimulate myself through this cloth. This is pretty thin, which I can use just for the placement purpose. So one pad should come above and same axis lower. So this is the correct way. One channel, 2 pads in the same axis. Now if your pad size is smaller, as in few machine the pad size is smaller, you can actually stimulate lateral muscle group, medial muscle group separately. So medial is which is close to the midline. So this is my midline. Lateral is something which is outside. So these pads are pretty wide, so you can stimulate in one, or if you have lot of pads pending, you can stimulate like this. So these are the lateral muscle group, also known as vastus lateralis, and another channel for medial muscle groups known as vastus medialis. So principle remains same, along the axis, symmetrically opposite. Once you put it, then you have to wet it nicely. You have to wet it. Okay, I find sometimes if you use pads on a directly opposite muscles, like the function of this muscles is leg straightening, while the muscles group on the back side have function of muscle contracting. I find sometimes when patients are too weak, applying electrical stimulation to these opposite muscles simultaneously at a time, patient may feel little uncomfortable if they are first timers or beginners. So if you are one among them, you can use the front muscle group at a time and the back muscle group maybe the next day. So coming to this is the front muscle group. You can also place the pad little bit more laterally. So there are different muscle groups like gracilis. So these muscle groups we can stimulate. So laterally. Now my wife will demonstrate the pad placement on the back area as well as the hip areas. So I have still 4 more channels left. So you should understand this. The hip runs from midline, goes to laterally like this, and then there is a different group of muscles which start from the upper part of back of your thigh, goes up to the knee. So this part is known as hamstrings. This is known as gluteus. So the correct way of placement is, again, you can stimulate lateral part of hamstrings, medial part of hamstrings separately, or in the center together, depending on the size of your pads. If you want to stimulate gluteus, that is your hip muscles, the function of hip muscles is getting up from the squatting position, then probably you have to use another elastic band. So you can see the length of this elastic band did not fit. So sometimes you have to juggle around which elastic band to use. Okay, so this particular length fits on my hips. Once the elastic band is in place, then one pad in the upper part of the glute and another on the lateral part. So demonstrating on this side, one is here, another is here. Somewhere here we can place it. Yes. Okay, so this is I have more channels left with me and I can show on this side, but the concept remains same. I don't want to spend time on that. Now that pad placement is correct, you have learned the pad placement. Another principles of electrical muscle stimulation is use. So now you have learned the correct pad placements in the upper body, the lower body. I have more channels left with me, but I don't want to take your time. Concept is same. One last principle of electrical muscle stimulation for rehabilitation is use the muscle group which are bigger, larger. So there are muscles in the biceps also, triceps also, forearms also. But you can see that the muscle thickness, the content, the bulk of the muscles here is less. So by giving electrical stimulation on these muscles, even though you can see a lot of contraction, you can feel a lot of contraction, but the whole purpose of giving your body a kind of workout is defeated. Feel free to stimulate these also in addition to your main chunk. So chunk of muscles is your core muscles, that is chest, abdominal, thighs, gluteus, hamstrings and the back. So these are the muscle group you should target to. Once you are done with this, or for any reason you are not able to these muscle groups, then you should focus on this area. Otherwise, I see lot of time when patients are too weak or on the bed, the caregivers focus on these muscles. They spend their time, efforts and expectations, but with poor strength gain. So the purpose is defeated. So now you have learned the pad placement. Similar channels, it can be placed here or on the calf muscles also. Now I will be demonstrating the proper way of using these modes using my forearm muscles, because you can see the contraction there. So from my side I have covered maximum point which I wanted to convey. I hope I have given you the content which you were looking for. If you have more questions about pad placement and machine use, please put it on comments. I will try to reply. Watch out my other videos regarding utilization of different programs of this particular machines. Each machine is different. I will also explain how to decode a particular program in a machine, what frequency they are using and all those things. So watch out my other videos. Thank you. Namaskar. Good night.